Good evening, School District of Indian River County. This is your Superintendent, Dr. Moore, here with a midweek Facebook Live. We want to begin this Facebook by really saying thank you to everyone in our community. As we are navigating extremely difficult times in a very complex situation, the School District of Indian River County's parents and children, faculty and staff have stood up in a very, very positive way. And I truly appreciate all of the support and all of the willingness to work together in this difficult time. The reality is everyone doesn't view the issues that we're currently dealing with in the same view or the same way. But what we're seeing in terms of implementation, in terms of willingness to move through this together, is something that we all can be proud of, regardless of the side or the stance that we take. So I truly appreciate each and every single one of you, appreciate the advocacy, standing up for what you believe in. This is a difficult time. We're going to move through it efficiently, effectively, and as quickly as possible. So I want to provide some quick updates. This is information from the Cdc Tracker. It is updated as of today. It will update again this evening. But as you can see in looking at this, cases about 10.31% increase over the course of the previous 7 days. But rest of the data points seem to be on a downward trend. So those are all initial indications that we're on the other side of the hill heading our way down. Hopefully we continue to monitor and look at that data set. But this is kind of where we are as a community. Our dashboard. I would encourage each and every single family on a daily basis to update and look at our dashboard. This is the current dashboard, as mentioned before, in comparison to other counties. It's probably one of the most transparent and informative dashboards that you'll see out there in comparison to the other counties. We have included information regarding home tests because we wanted everyone to know what the reality currently was. Now that we're moving into the school year and our data sets continue to grow, we are making a modification to our dashboard that gives us a better reality or a better picture of what our current reality is. So if you were to look at our dashboard in the coming days, we're in the final phases of testing this new dashboard. It's not only going to give you the year-to-date information, which tells you over the course of the entire school year. This dashboard will provide information in regards to what's currently happening. So rather than looking at the total number of positive students, as an example, over the course of an entire year, you can look at the total number that currently are positive in our schools. It gives you a better picture, a better reality as to what's currently going on. And the same would hold true with the school site information. So you'd be able to look at schools, and we have received calls or concerns regarding individual schools because the numbers were so high. But when you look at it of what we're currently dealing with, it's a much better picture versus comparing that reality or that data set over the course of the entire school year. This is a 2-week look back. So this is kind of where we were over the course of the last 2 weeks. So 2 weeks ago, we had positive cases for students of 228. And then when you look at the week that just finished, 413. So positive cases for students is something we're still very concerned about. When we look at staff positives, it is the opposite trend. That number is going down. That is a key number for us. It's a driving force in terms of being able to maintain the operation of schools, which is the primary concern that we had, which led us into the new requirement of the face coverings. And then you see student quarantines, obviously, when cases for students go up, as do quarantines. So quarantines is something that we're continuing to look at as we move forward. I want to remind parents as we navigate this difficult situation, please, every single morning, check for symptoms. In order for us to get ahead of this, we cannot have students in school or faculty or staff in school who ultimately end up being positive. It's not 100% avoidable. Sometimes symptoms, the onset is while you're in school, and we understand that. But if we all can work together and be proactive in looking for symptoms so we can make sure that we are not getting ourselves in situations where additional students have to be sent home or be quarantined, we would greatly appreciate that as a level of accountability, and we will continue to display the compassion that is needed for students in providing the makeup work and providing online instruction. We're committed to being extremely flexible to move through this, to have all students in school and being provided quality instruction. This is a nice data set that you'll see here. We have implemented the revised face covering option, which is providing the medical opt-out or a 504 or IEP issue. So we see now we have 6 for the IEP/504 and 67 medical opt-outs of the participating grade levels. That's 0.7 participation with that. So we're very, very proud that we're able to implement with such a high level of fidelity, very little concerns being stated. But if you have a concern and you are a parent and your son or daughter is coming home and telling you something that doesn't sit well with you, please reach out to the school, whether it's a mask wearing issue or being teased or picked on because I have an exemption, unacceptable. So if you're having those issues, get that information to your principal. If that issue isn't being resolved, please call my advocacy office, call myself. We're in a difficult time. People think very, very differently. What we're doing in our school is to put students first. So if there are any issues on either sides of the issue, please let us work with you to find a resolution that keeps children in school, keeps everyone feeling as if they are embraced, warmed, and welcomed in these schools, because that is a non-negotiable expectation. When you look at some new information that's coming up, we're adding 2 in partnership with our health department testing locations that will be specifically for school-aged children and the faculty and staff of the School District of Indian River County. So you'll be getting additional information, 2 different sites, really to speed up the identification of a positive COVID case, as well as speed up getting our students back in school when they have that negative test. So be on the lookout to really speed our process of getting students identified as COVID positive to get the support that they may need medically, as well as getting students back into school who were COVID based on these 2 new testing sites. So we're excited to be able to offer them. This will speed things up for us drastically and allow us to move through the process and be acting in real time, ensuring that we do not have a delay between the onset of symptoms, the testing, and waiting for those symptoms so we can act quickly with the addition of these 2 sites. And we certainly thank our health department for allowing us the opportunity to partner in creating of these 2 particular sites. At this time, we have a presentation by Ms. Crisafulli, who is our district staffer, who is working and leading a lot of the work and support for principals around COVID. This is the opportunity to have real honest conversation regarding some of the requirements, some of the questions, in real layman's terms regarding COVID criteria. So at this time, I'm going to turn the microphone over to Ms. Crisafulli, who will answer any questions you may have.
Hi, my name is Beth Crisafulli, and I'm a school district employee. I'm here today to share some information, or basically answer some questions that a lot of parents are having in regards to COVID, testing positive, getting quarantined. I have the privilege of supporting the schools and working to support the health department. So I just wanted to share some information kind of in layman's terms to help our community. So first, if your child is not feeling well, you should keep them home. If you think that they might have COVID and you're going to take them to get a test, please keep your child home until you find out the results of the test. It might be positive, so please just keep them home until you know for sure that it's negative or positive. If it is positive, we of course would like you to contact the school to let them know, and then that information gets passed to the health department. Your child, if they're positive, should stay out per the health department emergency rule for 10 days, and they would return on the 11th day. So if your child is positive, they would have a 10-day quarantine, and they would return on the 11th day. Now, there's a couple of caveats. Number one, if you are using a home test, something that you went to Walgreens to buy, those are not a diagnostic test, which is what is required by the rule. So if your child tests positive with a home test, we would still want you to call the school. We still would like you to isolate at home for 10 days and return on the 11th day to make sure that if you really are positive, we're not exposing other students. The diagnostic term is confusing for a lot of people. So that would mean that you're going to Cleveland Clinic, you're going to your doctor, you're going to urgent care, you're going to the drive-through at CVS to actually have someone give you a test. Those are diagnostic tests. They can be a PCR test, they can be an antigen test, or a rapid test, which is the most popular. So those are what are considered diagnostic, and if you're positive, you are for sure positive and you should isolate away from others. So first, if they're feeling sick, keep them home. If you go and get them tested, please keep them home until you know the results of the test. And then we always, of course, want you to communicate with your school to let them know what's happening. So if your child is positive, please understand we have a whole system set up to make sure that they get their work, and the absences while your child is out will be excused. So that covers testing and staying home until you find out, and if your child is positive. Now, the other situation with testing positive is once it's been determined by a test that you're positive, part of the new rule is that if you go and get another test and it shows that you're negative, you can come back to school with that negative test. So that is different from what has been previously in place with the health department rules. The next situation is close contact. So let's say a student in school is positive and the school calls you to let you know as a parent that your child has been around someone that's positive, which the health department calls a close contact or direct contact. The rules for the quarantining period for close contacts are it is only a 7-day quarantine and your child could return on the 8th day. You can come back early if you go and get a test, but the test has to be on the 5th day after the exposure to the positive or later. So if you don't want to go and get a test, you can just stay out for 7 days and come back on the 8th day. If you want to go and get a test because you want to come back to school, which is very awesome, you can go get a diagnostic test. So that's one of those, like I talked about earlier, has to be a rapid, it has to be an antigen or a PCR, meaning that you have to go to the Cleveland Clinic, the health department, urgent care center, and get a test, not a home kit. If that's negative, then you can come back. What if you're vaccinated? Okay, so if you are vaccinated and it's been determined that you're a close contact, you do not have to quarantine. And so we are having the health department go through the list and let us know this child has been vaccinated, they don't have to quarantine. So it might take 24 hours for us to get that information back. So if you get the call from your school administrator that your child has been deemed a close contact and they must quarantine, and they're vaccinated, you need to let your school principal or administrator know that, and then we can go from there. So, however, if you're vaccinated, it doesn't mean that you might have symptoms and you might turn up positive. So the biggest part is a lot of the symptoms of COVID seem like allergies, and being someone that has a lot of allergies, I've probably tested and gone and gotten tested maybe 4 or 5 times in the past year, which have all been negative, because I have allergies, and those are a lot of the symptoms of COVID. So if you think that your child is exhibiting any symptoms, please keep them home, and if you are choosing to get tested, please make sure that you are communicating with your school. So I think that we've covered everything that we want to discuss today. One, just to review, please keep your child home if they're sick, and if you've gone and gotten them tested, please keep them home until you get the results. Communicate with your school to let them know what the status of your child is. If you test positive, it's a 10-day quarantine, coming back on the 11th day, unless you go and get tested again and it's negative, then you can come back as soon as you get that negative result. If you're vaccinated, you do not have to quarantine as a close contact, but the regular quarantine time for close contacts this year is a 7-day quarantine coming back on the 8th. So if you have any questions, please call your local health department. You can also Google the emergency order and print off the rule so you can see it all on paper or on your computer. Thank you very much.
Thank you, Ms. Crisafulli. Very, very meaningful information. And please, we're going to take a frequently asked questions information. We're going to post it on our website. So a lot of the information that was just presented, you can refer back to it on our website to have that information. Also want to share some information about our Z-Pass identification cards. We are now in the final stages. We should be reaching full implementation. Please make sure your students have these cards on a daily basis. Bus transportation, food services. Replacements are $5, but what we're seeing is a high level of implementation. It's a new behavior for us as a school system, but it is a high level of security and safety that we're implementing and a great deal of convenience for our students and our parents. So we're going to continue to support that new initiative. Please encourage to remind your students as they're on the bus, buckle up. It's not an uncool thing to buckle up, and we need to ensure that we're supporting that both in our schools and while we're on the bus, as well as being home. I want to continue to ask everyone to continue to reach out and follow us on social media. We truly appreciate all of the support, and our goal, as you know, is to keep our community informed as much as possible. And as I close, I want to reiterate everything that I started with, just a level of appreciation and thanks for the willingness of the school district of Indian River County's community to come together in a very, very difficult time to support one another as we navigate this reality. Our goal as a system is to move through it as quickly as possible, making sure that we're taking every single step possible to ensure that our schools can stay open, our schools can stay safe, and every student has the opportunity to access a free and appropriate public education. Thank you for your support.